Hello, my name is Devika and I am the instructor for Heavenly CNA, and today I'm going to show you the tutorials on how to complete the 17 skills for Headmaster training. For TED holes, all you would need is just one TED hole. Hi, Mrs. Jones, how are you? I'm Devika and I'll be your nursing assistant, and I'm going to be putting on your anti-embolic stocking. Is there anything I can do for you before we get started? No? Okay. So I'm pulling the privacy curtain to provide privacy. Let's move this out the way. Always put on your hand sanitizer prior to touching the patient. And you need to make sure that your hand sanitizer is completely dry on your hands. So I'm going to pull Mrs. Jones' covers back and expose only one leg. I am going to raise the bed so that it is at a good working level for myself. If you raise the bed, always remember to lower the bed before you leave out of the patient's room. So I have her anti-embolic stocking / TEDs or compression stocking, just depends on what you would like to call it. Now when you put these on, they're real tight to the patient. So it's going to be a little easier for you to slide it on the mannequin, but when you're doing a regular patient, it's going to be a little tough. So make sure that you put your hand inside of the stocking, at least to where the heel is located, and you have a square that represents where the heel is, and you're going to pull back out. And this is for it to be easier for you to apply the TED holes. As far as the hole at the end of the stocking, it doesn't matter if it's on top or at the bottom. So you're going to put the feet in and make sure that it goes above the heel. And then you can gather the top of the stocking and just pull it all the way up the leg. The goal of this is to make sure that you do not have any wrinkles in your stocking, and you have to make sure that there is a little room at the end of the foot so that you're not applying pressure to the toes. All right. The stocking is free of any wrinkles. I checked the toes. It has a give. It's not going to put any pressure to the end of the toes. All right, so Mrs. Jones, is there anything else I could do for you before I leave? No, you're all set. Okay, I have your call light to the left. I'm going to put your bed down. Would you like your head raised at all? No? Okay. Make sure you always put your bed down to the lowest position before you leave out of the room. You're going to close your privacy curtain. Put the bedside table back. And you're going to make sure that you end your skill with applying hand sanitizer. Skill complete.